You don't have to live with pain or chronic neuro issues any longer. In this podcast, you will learn how to stabilize your brain, body, and biochemistry for the rest of your life. I'm Dr. Teams, and this is the NeuroRESET podcast. Hey, everybody, welcome back to another episode of the NeuroRESET podcast. We have a very special guest, one that turns out we've known each other for like 30 years and just reconnected more in the last 5 or so. But we have Dylan Valenzuela, right? Am I saying that right? So he's at iCan Wellness. He does he's a dietitian by training. Is that right?
Dietitian, dietetic medicine specialist. I manage chronic illnesses. So, but yeah, dietitian is an easier way of just putting what we do.
Love it. So, technically an avid golfer. It's just the clubs are a little dusty right now, but you know, we're going to talk about all things health, kind of talk about some of the cases we've worked on together. I've had him put like the CGM in my arm, tracking some stuff. So we'll tell a lot of stories on overall nutrition, health, and then everything, what he's doing and how to get a hold of him. So welcome, Dylan. Thank you for doing this, man.
Well, thank you, man.
Appreciate you being here.
Yeah. Russ. You know, like Russ said, we've known each other for greater than 30 years now at this point. Pop Warner football.
Yeah, started with Pop Warner football, the Bearcats, right? Was it the Bearcats?
Storm or Grizzlies?
It had to have been the Storm then.
It had to be the Storm.
So we were probably like 10-ish years, Joel, 10-ish years, 10, 12. So
it's been a hot minute. It's so awesome to see, you know, both of us aspiring our dreams into the medical industry.
And I think we were both quarterbacks too.
Yeah.
So we were both quarterbacks, and now we're both in the health world. So it's bizarre.
We just took a different turn. We took the left turn, you know.
Yeah.
We decided, hey, you know what? We might need to be big enough for it, but at the same time, you know, we know that our brains are probably a little bit better.
Yeah, for sure.
To go down a different route.
Well, you know, it was funny. I didn't play football much after that. I know I had one concussion in that world. But then baseball got me a couple times, like 2 or 3 times. And then jiu-jitsu got me. And so I'm like, all right, I'm not made out for all this contact sports stuff, so I'm going to stick to golf. Definitely going to stick to golf.
I mean, it's a
although you can do nutritional damage with golf, right?
You could. You definitely could, depending on, you know, who you're golfing with and where you're golfing at. But yes, you could, and depending on what your score is.
Yeah, exactly.
You know, Bogey would agree.
Mr. Bogues.
You know, I decided just to, you know, take that pathway into, you know, more of a medical driven world that, you know, I felt like I had just more of a passion, more of an interest in it.
Yeah. So how'd you go down that road? What made you go down through dietetics?
Will you bring that mic a little closer to you?
Of course.
What, he's not loud enough?
No.
That's a surprise.
That is a surprise. That's a huge surprise, actually.
So, but yeah, we can always mess with that stuff after and just tune it up. But so yeah, what made you go into the field of like dietetics by itself, but then medical dietetics?
So what originally started was, you know, after high school and everything, you know, going to college and, you know, studying physiology and kinesiology, I really wanted to be an orthopedic surgeon. I really wanted to go into the ortho world. And I wanted to be that, you know, since I knew I wasn't going to be that big guy on the football field, I wasn't going to be the, you know, home run hitter for a baseball team. I wasn't, you know, I was a good tennis player, but that's, you know, I didn't have the stature and the power that it was going to take, you know, to be a good, solid tennis player. I decided, you know what, let me shift my gears and let me go towards, you know, the medical field. And I want to be that guy on the sidelines. I want to be that guy that's actually going to go out and run on the field, assess the, you know, the player, essentially patient, and, you know, be there to, you know, treat and help. You know, because I've had my injuries, just like you've had your injuries.
Yeah.
You know, and you know, I want to be able to actually provide a care plan for them so they can get back on the field, they can get back on the court. And so I decided, okay, physiology and kinesiology is going to be my route. So I started studying that, and then in order for me to get letters of recommendation for medical school, as you know, the best bet is to get into a primary care physician's office or the field that you think that you're going to be a part of. Get into that office.
At least get a little experience, right? Intern, shadow, whatever you can do.
Get some type of just, you know, just sitting in the room with the guy, you know, or the woman, and, you know, learning from their traits and what they do. And so after a couple of months of being in there, you know, based on how qualifications went when it comes to applying for, you know, schooling and everything like that, I decided at that time to venture off into the dietetic world. And that was because of the physician that I was working for at the time. He said, hey, you know what, I understand what you do and what you have as far as your background. Why don't we run a program for a couple of months? And let's just see exactly how this goes. And the program was going to be more of diabetic education. You know, you got a good understanding of what it takes to, you know, have patients lose weight, get their diabetes better. And I'm starting to see, and this is speaking of his shoes, I'm starting to see the diabetic incline of the patients that I have in my office as a primary care physician. So let's work it for 3 months and let's just see what happens. And 16 years later, I'm sitting here on NeuroRESET with my boy Russ.
Right.
Talking about dietetics.
And would you say you're still your primary patient, customer, the people that you help the most is the diabetic population?
I would say that's the majority. If I were to put it in a percentage, I would say that's probably the majority of the patients that I do treat. But as being a dietetic medicine specialist, I'm managing most chronic illnesses. I'm managing hypertensive disorders, so your blood pressure patients, your high cholesterol, your hyperlipidemia, diabetes, whether that be type 1 or type 2.
Stuff.
Yeah, autoimmune disorders, Hashimoto's, even psoriasis. Has to deal with our sugar, input and intake. So it ranges from a wide. I mean, we go from GERD to sleep apnea to certain types of cancers that are associated with our weight-related issues. So it's a laundry list of things that we've actually found out in the past 16 years. It used to just be, blood pressure might have been stress-induced. Diabetes could just be like, yeah, you're eating poorly. So we'd only had really one major chronic illness, which was diabetes. So we attacked that.
Yeah. Isn't it weird over the years, like you said, probably when you first started, you're like, yeah, it's like obviously lifestyle-related diabetes.
Right.
Now it's like, I don't know why. I've seen people in my family have like pre-diabetes, and you tell me if you see this, but pre-diabetes, you can try metformin, you can do all the dietary stuff, you can do the working out, nothing makes it budge. Then they retire, and it all goes away.
Right.
Stress-induced, right? And that's
cortisol levels.
Right. And so it's bizarre looking at what we're dealing with now as healthcare practitioners versus what we started with.
Very true. Because 16 years ago, we weren't even looking at continuous glucose monitors besides for type 1 diabetics.
Or what even is in the food we're eating, right? We can go down the rabbit hole on like glyphosate and all that stuff. Plus, and that's not even the worst one.
Correct.
That's what's crazy is now we've got all these names for things. And so if we have the time, certainly let's touch base on, hey, here's the things that the names are changing to if you're up, if this is something you do, and just gives these people something to like look out for.
No, absolutely. And you know what, when it comes down to, looking at a label, you're not just looking at nutritional facts anymore. You're looking at your ingredient listing. And I've always kind of like lightheartedly made the joke to a lot of patients, if you can't pronounce it, it's got more than 16 letters in it, you probably shouldn't buy it.
Right.
Put it back on there. So anything out of a bag or a box is going to be something that's going to be processed, ultra processed, and have a multitude of different types of artificial components, additives, sweeteners, coloring, and all of these things play a huge role in our physiology. It's going to change the hormonal structure of how our body balances things out. So, I mean, if you imagine, like, you and I are, the same age as back in the day, we had the equalizer, to a stereo.
Age.
Yeah, age.
Age was the equalizer, right?
So we have this balance, and it's just like we can't find that balance unless we equalize everything together. And so when it comes to we have 53 artificial sweeteners, and that's not additives, that's not colors. We have 53 artificial sweeteners in the world right now, mainly in our country, that a lot of people have no idea that it's an artificial sweetener, which is false triggering insulin production.
Right.
If you false trigger insulin production and you're already in the pre-diabetic insulin resistant category, it's going to start to cause these huge, rapid changes in your body weight, rapid changes in increased diabetes issues, increase in blood pressure, cholesterol. Now we're looking at the trifecta.
Yeah.
And now we're treating not just one thing, we're treating multiple things for these patients. And that just spirals itself down to osteoarthritis, neurological issues, Alzheimer's, dementia. These are all just excess collected protein enzymes that are collecting on top of the brain. And if we can break these things down and give the patient a better understanding of how not to necessarily, you can't reverse it, but you can slow down the progression.
Right. Or let the processes that are designed to take out the trash become more active.
Right.
Right. And so that's obviously we're talking autophagy and stuff like that.
Yeah.
But okay, so let's touch base on of the sugars, sweeteners, stuff like that, because most people, I mean, hell, everywhere you go, there's sugar in everything, right?
Sure. Yeah.
So what would you say for everybody listening would be better alternatives if they're like, I need something in my X? Like iced tea is a big one, right?
Coffee, iced tea.
Yeah, coffee, iced tea, stuff like that. What's the better alternatives that you like to use? And I'm sure there's an asterisk with everything, right? Because it depends.
Right.
Where, like I always say, healthy food, it may not be healthy for you. In fact, in the term of like, say, food sensitivities, right?
Yeah.
So broccoli's healthy. in most people's world. Well, if you inflame when you eat it, it might make blood sugar changes, all these other things. So it's not healthy for you.
Right.
So just know that there's always an asterisk with a lot of this stuff. But in general, like, are there things that you would trust and be like, it's okay if you have this, but in moderation?
So when it comes to artificial sweeteners, just kind of, backpedal on that one. With artificial sweeteners, since we have 53, we actually have 2 that we have studied in roughly about 6 to 7 years worth of medical research, that stevia and truvia are the only ones that are not false triggering insulin.
Okay.
We have a lot of research behind that. We have a lot of medical data and clinical analysis to prove the same thing, not just within my practice, but also other practices as well that looked into this. Because, I mean, that is the world we live in. We live in a world that, sugar is a compartment in our brain that just ignites.
Well, and it's so addictive, right? They say it's
absolutely.
more addictive than certain drugs, right?
Oh,
and
I mean, how many times we've heard the 8 times more addictive than cocaine?
Yeah.
And
it's just a super dopamine driving drug, a super dopamine driving chemical being sugar, right? Excuse me. Funny enough, I always thought that I had a sweet tooth until I started going more carnivore.
Yeah. Okay.
And I'm like, oh, I don't feel like I need to eat all that. Like I'll have my dark chocolate and my coconut, right, from Costco. But at the same time, I get home and I'm not like, hey, do we have any snacks?
Right.
I do that so much less frequently since I've gone more, I guess you could call it like heavy carnivore paleo is probably what I'm doing.
Okay.
My wife loves mixing other stuff with it, but generally I'm fine with just eating meat. I'm like totally cool with it.
Well, and you know what? Again, it's just the way that we have reconstructed the foods that we eat within our society nowadays to mass manufacture to provide to the society that we have now. It's become much different, and what it's doing is it's changing our hormonal balance. We were talking about cortisol a second ago. Cortisol is a huge one. It's co-capped in its glucose. So if you have a high-stress environment, high-stress job, and then you're putting more stress on the body when it comes to some types of foods that are coming in that have hormonally been re-engineered to mass produce, all of a sudden now we're creating more cortisol. We create more cortisol, then we're creating more glucose into the bloodstream. We create more glucose, we create more insulin. So now all of a sudden it's like, even though you might be eating
it's like
chicken,
a domino effect, as opposed to, it's just going to do this in a nutshell, but it's like it's a domino effect, right?
The chicken's not the same chicken we had when we were kids.
Totally.
And that's the frustrating piece to it. Like you were mentioning, broccoli might not be the best for you, and that's where continuous glucose monitor is really very helpful, very informative, and very data driven to where you could see what looks like healthy on your plate. I was just explaining this to a patient recently this past week was that quinoa protein power bowl that you get from this restaurant, although it looks like as a full holistic and
it has
perfectly
protein
balanced
in
meal.
it.
Yeah, it's got everything that you need. The problem is it looks like you ate a cheesecake.
Yeah.
And that's the issue.
And that's their body's response.
Correct.
Like I might have a totally different response, right?
You might have a great response to it. But this patient, unfortunately, since they're insulin resistant, pre-diabetic, possibly polycystic ovarian syndrome as well, so they have that underlying insulin resistance. These are the things that we need to do better as medical providers to actually research a little bit more and investigate a little bit deeper. And that's what I'm really trying to do in my practice right now is making sure that these patients have blood work done beforehand. And it's not respectively to our primary care physicians, it's not just your CBCs.
It's not the basics.
No, it's not the run of the mill.
And that's what's cool lately is most patients, and you're probably seeing this too, is most patients coming in are more educated than they were 5 years ago, right?
Absolutely.
And so they're like, I have Hashimoto's. You're like, oh, cool. Somebody ran that. They're like, well, I had to ask them to run it.
Yeah.
And then it's like, okay, so people are doing their own research. Like Google University is certainly helping in many aspects in terms of getting awareness out. So it makes our jobs a little bit easier when they show up with it.
Yeah.
And so, but then, we can take it to another level. You can certainly take it to another level.
Oh, absolutely.
That's necessary.
Yeah, and that's, there are pros and cons to it. The biggest pro is that, people are more interested in, what do I need to do differently to better my health? That's the biggest positive that you can take away from it. But the biggest con is that you got to get to Google page number 79 of a million to just actually read some solid validity as far as research goes. Just reading
Stuff
page
that's not
one.
just trending, right?
Yeah. And that's sometimes I have to kind of like reel back that patient and tell them, hey, we need to look a little bit deeper than just because you have cold intolerance, just because you have a little bit of hair loss, that could be protein deficiencies. Cold intolerance could be a lack of estrogen within the body and increased testosterone. At the end of the day, let's look at these things. Let's get the way I kind of tell patients is when you do a body composition test, That's a blueprint.
Mm-hmm.
But how does that blueprint operate? Operation is the blood work. So in order for me to find out exactly what we need to attack first, what lane we need to drive down, instead of giving you like the kitchen sink in one sitting, let's start here. Your cortisol function's elevated. Let's talk about some supplements that you could take to reduce your cortisol function, because that is causing your glucose to elevate, which is causing your insulin resistance. Let's look at ferritin levels. Let's make sure you don't have fatty liver disease. Let's make sure you don't have kidney or renal insufficiency. So all of these things wrap back around to what kind of dietary structure you specifically individually need to be on. And that's why I do take a lot of pride in what we do at iCan Wellness, is the fact that it's an individual appointment with that patient. It is just one person to another. Give me what you have. Give me your history. Give me what's happened in the past 25 years of you battling this battle, the journey that you've been on, and let's investigate a little bit further instead of just putting a Band-Aid over a gunshot wound.
Right.
So
Band-Aid over a gunshot wound. I like it.
I mean, that's essentially what a lot of these people are doing nowadays.
Well, so what would that be, like metformin in your world?
I would probably say berberine.
Berberine. Okay, yeah. So
I'm a big fan
version,
of berberine because it reduces the side effects of metformin. I mean, with metformin, it's just tearing up a lot of patients' gut microbiome. Now I have to deal with
But what's interesting is people are starting to hack with metformin now, right?
Yes.
And so because it's like super readily available, it's generally looked at as safe, but we know that there's always side effects to every med. Even supplements, there's side effects too, right?
Oh, absolutely. It just minimizes like the over. I mean, with metformin, you're looking at gut microbiome disruption. So you're looking at possible diarrhea. You're looking at bloating, lower abdominal bloating. You're looking at possible gas. They're very
Minor?
very minor in the grand scheme of things, very vanilla. But at the same time, berberine is reacting very similar to it. It's a natural supplement that our body's just lacking in a lot of ways. So they get minimal side effects. And as long as it's being put in place for a patient in the proper way and being managed properly, then you're going to be okay. We start you maybe on 1 a day, and then we take it up to 2 a day. With metformin, it's like, it is cost effective. It's $4 for a 90-day supply over at Costco. Great. But at the end of the day, I want to try to minimize your possible side effects and adverse effects that could happen from something like that. Yeah. And with berberine, it is a more natural supplement. So I try to take that naturopathic type of approach and go through more educational and counseling versus just like, hey, let's give
this
metformin.
Is my protocol. Right.
And if we need to go down this route, we can eventually discuss that route. Yeah, for sure.
For sure. I dig it. So let's see. We talked on the the sugar stuff, right? The sugar alternatives. Let's go through a couple of maybe different diets, right?
Yeah.
One thing that I want to talk about is people who are on vegetarian and vegan.
Yes.
How effective do you find that long term?
Long term, I believe if you do more of a flexitarian type of structure, where you're not a complete vegetarian, just using eggs, you got your fish in there, vegan, very high carb, depending on what the patient's past medical history is, could be very detrimental to their long-term health. Now all of a sudden insulin resistance comes back into the picture. Flexitarian, where you're kind of educating more on your lean proteins. Minimizing the red meats within your diet. Honestly, and if we're looking at what you provide to your patients as well, from a neurological perspective, a Mediterranean style diet is going to be one of the best maintenance structures that you can provide to your body. It's providing good healthy fats, your DHA and EPA from your omega-3 fatty acids, which is obviously going to help with your neurological health. And it's also providing with your grain sources, which are still imperative. Glycogen is still a very important piece to your body's mechanism of action. In order for you to repair muscle, you need that.
Yeah. So when somebody is obviously like you're talking about diet, let's look at diabetic or high blood sugar pre-diabetic stuff, right? People who are resistant to getting back to normal.
Yeah.
How, I guess every case is a little different, so it's not a fair question, but how intense do you have to get in terms of like protein and fat only and restrictive on the blood sugar and like things like grains? Like it's an example, when I had mine in, the first day I got it in, I was, we had the nephews come in town like the next day. Yeah. So we were eating little different things. We went, saw a movie. I ate popcorn, freaking shot my blood sugar through the roof, right? So I didn't eat regular corn, but I imagine it would do the same thing. And so corn and grains for me, like I feel great eating rice, feel amazing eating rice, but everything else is like, it just screws me up. Yeah. That being one of them. Yeah. So I'm curious as to how much or how long you deplete or keep people low on carbohydrate, focusing on the protein and fat side of things. So for me, I've always seen the most neurologically compromised cases tend to be like vegan.
Yeah.
And whether they're doing it right or wrong, like I've seen a couple of people, there's a few bodybuilders that are known as like vegan bodybuilders, but like that's their job, is to eat right so that they can bodybuild, right? It's very is it difficult for vegan and vegetarian people to get all the nutrition they need for their brain?
Yes, absolutely. 100%, because and not just for the brain, but for the entire physiology of our body.
Yeah.
You know, you'll get some proteins from your grain sources, obviously. You'll get it, you know, from your vegetables, but you know, our body is in a lot of ways very carnivorous. It's built off of animal proteins, and that's the absorption of that and the bioavailability of that is a lot higher than just your vegetable proteins that you're going to be getting.
Right.
So I'm not opposed to vegan, vegetarian, but when I do see these types of patients that have that kind of restriction on their diet in my office, they're typically the ones that have higher insulin levels, have higher cortisol levels. The body's under stress. It's looking for energy. And that energy is not able to be broken down because their body doesn't understand the difference between a good carb and a bad carb. If the insulin production is so high in the body, the body doesn't understand a bag of potato chips from a cup of broccoli.
Right.
Now, it does grab those trace minerals besides, you know, from the bag of chips.
Yeah.
But it sees carb for a carb.
And carbs are carbs, meaning like proteins turn into carbs, alcohol turns into fat, turns into carbs, like everything turns into it at a different rate. Is that correct? Could you help them understand so that if they don't know, they can start to make maybe better choices on limiting their glucose intake or what these foods do, or like combining foods, what that can help do for blood sugar levels and stuff like that?
No, absolutely. And, you know, that's a really good question, actually, because when you look at it, you know, you have a complete protein. A complete protein is going to be mixing starch with fat. So like avocado toast is taking a complex carbohydrate and a fat. That makes a complete protein. So when it's digested in the body, what ends up happening is the absorption of the protein inside of the system is going to be at a higher rate because you're producing glycogen, or you're bringing in glycogen to repair what glycogen you've lost. Maybe that be fasting, maybe that caloric deficit, and you bring the fat to stabilize glucose changes. Now, you wouldn't want to just have a piece of toast with butter. Now, granted, okay, butter is fat, carbohydrates, it looks like a complete protein, but that's not your healthier fat. Your healthier fat is going to come from avocados, almond butters, cashew butters, things of that nature that are going to be more naturally, you know, produced, you know, in a natural state, an organic state. So to stabilize glucose changes, you know, obviously protein and fats do have a small response to insulin function. Okay, so we got to make sure that we're kind of monitoring the protein intake, but that's where we put the continuous glucose monitor on that patient to find out what is it that you're responding to. Yeah. And then we can figure out these types of proteins, these types of carbs, simple sugars, complex carbohydrates, simple carbohydrates, all these different types of carbs that we have. Net carbs, you know, obviously is one that I fight with a lot of patients with about, you know, it's carb, you know, for you right now. Dietary fiber is important to break down protein, but it's not necessarily as beneficial to help break down the carbohydrate. Because that carbohydrate is still going to convert itself to glucose. And that's where it's like, okay, we need to start figuring out ways around these types of structures of what you're eating currently. Yeah. And that's why journaling is really important. You know, and when I see a patient, the first time I ever see them, I always tell them, I need you to journal. I need to live within your shoes. I want to live within your shoes so I can get an understanding of what is it you're currently doing right now. After a week, we look at it again. We see exactly, okay, what's your timing? What's your choices? What changes do we need to make? Because you might be eating the right things at the wrong time. Because we're all structured on a rhythm. So at the end of the day, when we don't have a rhythm to our cycle, what ends up happening is the body gets disrupted in understanding when it's using food for fuel versus fat for fuel. So if you're really trying to achieve optimal glucose levels, you're really trying to achieve optimal cortisol levels, ferritin levels. In order to do that, you need to let the body know, when am I operating? When are the lights on? You know, when am I actually using food for fuel versus my fat for fuel? And if you're in your constant state of this ebb and flow, then that's when the cortisol level increases. Right.
So back in the day, so in between our original quarterbacking and running into each other in that barbershop, I was doing personal training. I totally just lost it. But back then, all the nutritional training was 4 to 6 meals a day, right? Yeah. Are we moving back away from that 4 to 6 meals a day, or is that still a piece of the puzzle?
It can be a piece of the puzzle.
Okay.
16 years ago when I first started, in dietetic medicine, it was
like the gold standard.
It was
almost,
the gold
right?
standard. That's
well,
what
because
we
it makes
used.
the most sense. It's
It
like,
did.
oh, you want to keep it stable, so you want a little bits here and there.
Yeah. And this was well before we started studying insulin function.
Right.
So we didn't know the ability of what insulin really truly is in fact doing for our bodies and what it's meant to do and what it's not meant to do.
Right.
So yeah, 16 years ago, absolutely. I would definitely put a patient on within 30 minutes of waking up, you're going to either drink a protein shake, you're going to have some eggs in the morning, depending on like cholesterol levels and stuff like that. I plan it for you to eat about 4 to 6 small meals a day. Now, the more times that I see a patient with these high insulin levels, the only way to suppress insulin is by intermittent fasting.
That was the next question.
You can't suppress insulin function because you fight a double-edged sword.
It's like you're trying to decrease the fire by giving it more fire.
Yeah,
Or more fuel, right?
exactly. And so could I have you do like 2 eggs in the morning? It's just proteins, it's just fats, very little to absolutely no carbs and no sugars, no response to the insulin, very minor response to the insulin. The problem is that there is a response to the insulin. So you're breaking this fast physiologically. So at that point, it's like, I have to have you fasting long periods of time. So we have this new lab. It's called an insulin resistance score. I would definitely advise anyone that's listening to this to get an insulin resistance score. It's very uncommon for a primary care physician to want to do it. It's more responsibility they have to take on. They're more worried about your liver, your kidney function, and your fasting glucose and your cholesterol. All the specialty labs come from you and I, the specialist. I'm going to do this certain lab that you probably never heard about, but it's going to give me all the information I need. An insulin resistance score gives me an understanding of how long does that particular physiology need to be fasting for.
Oh, really? Interesting.
So there's no more guessing. If the insulin score, it ranges between 0 and 100. Okay, so just to bore you real quick, 0 to 33, a 16-hour fast would be acceptable. 8-hour eating window. Anything above 33, you're looking at an 18-6. 18 hours of fasting, 6 hours of eating. Anything above 66, now you're looking at somewhere around the range of 20 to 4. 20 hours of intermittent fasting, 4 hours of eating.
Yeah, you're almost doing a full day fast.
Pretty much a full day fast. And
So the higher the number, the worse it is.
Correct.
Right? So just out of curiosity, do you know how that's measured? Is it like the response to like how quick it spikes versus how long it takes to come down? Is it all that?
So it's measured off of intact insulin.
Okay.
So as soon as a gram of carbon sugar is introduced, it's kind of like a GTT, a glucose tolerance test. As soon as that gram of carbon sugar is introduced, it measures the intact insulin, the amount of insulin that's produced within the system. So for instance, if you take 1 gram of carbon sugar, your body's producing 5. So you're already in an insulin resistance category. So you can go 1 for 1, metabolize that 1 gram of carbon sugar to be elementary, but those other 4 insulin store as fat. Then their C-peptide comes into play. And I always call C-peptide the co-captain, okay, to make it easy for people. So when the co-captain comes in, it goes back for seconds. So you might have done that 1 for 1, taking care of that 1 gram of carbon sugar, but now you have 8 insulin storing as fat. Again, a very elementary way of putting it, but in retrospect, you're just gaining more and more fat by just 1 gram of carbon sugar that's introduced to your body. So intermittent fasting is really the only thing that's going to resolve insulin resistance. It's going to improve PCOS symptoms. So, dysmenorrhea, for women that are dealing with, PCOS, hormonal changes in their cortisol function as well. It even affects your lipid panel, your cholesterol panel, and then that just spirals into blood pressure issues and so on and so forth. So, and that's why we're seeing menopause, hypogonadism much earlier than what you and I saw with our parents.
Right.
Our dads and our moms, it was a typical 50 to 60 years old.
Yep.
I mean, I'm seeing patients
it's
in
in
my
the
office
30s
that it's like
and
you and
40s.
I.
Yeah.
Like I have a patient who's 32 years old and his testosterone is less than 300.
It's crazy.
And you want to like 800.
And there's so many things that are contributing to that, right? It can be just the simple introduction of social media. Just going through the lecture. The election.
Yeah.
Everybody's stressed out about it. Like at first, nobody wants to see it anymore.
Right.
Almost nobody's going to be happy one way or the other, right? So like, we're not even going to comment on that, but it's like what that does to chronically having it in your face, and you're like, oh well, I'm stressed out, I'm going to eat.
Yeah.
Right. So we've got this whole like hyper
fat storing mechanism going on, and then we eat on top of it.
Oh,
And-
absolutely.
And everywhere you eat now, it's like, oh, you get the plates are getting bigger and bigger and more full.
Yeah.
Right. And more addicting.
Yeah.
And so, intermittent fasting. So for what it's worth, I intermittent fast just about every day.
Yeah.
So today I had my 4 eggs in the morning, but then I'm skipping lunch and I'm going to have a big old fat, basically a big fat steak tonight. So,
Big fat
but
steak.
it's like, so I'm doing like a 12 and 12, but
Yeah. Well, and that's still that is the traditional intermittent fast. So the fast that I'm looking at is more like what's called overnight fasting.
Mm-hmm.
Overnight fasting is going to be where you hypothetically have dinner at 6 p.m. and you wouldn't eat until 12 p.m. the next day.
Mm-hmm. Yeah.
But again, this is all on the lifestyle of the patient.
Right.
It's not a one size fits all.
Mm-hmm.
Not every person should be fasting. We get your insulin scores back and everything looks fantastic. What your insulin is asking to do is it's asking to work. It's working. It's asking like, give me an opportunity to do a job.
Yeah.
It's like looking around your office right now, Russ, and seeing the best employee just sitting behind a desk and just answering phones and typing on the computer.
Mm-hmm.
But you know the potential that this person has, but you're giving them no work.
Yeah.
So sometimes there are moments where it's just like, okay, your insulin function looks fantastic. What we need to do is we need to make your insulin produce and work so it can actually operate to your body to actually utilize fat as an energy source.
Mm-hmm.
Because it's just sitting there dormantly. So as soon as you eat a carb, it goes absolutely haywire.
Yeah.
It's pretty much like that person who didn't work for 5 consecutive days, and then on Monday you bring in a huge project for them, and it's like,
Yeah.
What?
Or
I don't
like
even know
all
how
of
to
it at
manage.
the deadline. Yeah.
I have no idea how to manage all
Yeah.
this. So there are cases where it's like, yes, we still do old school thermodynamic planning.
Mm-hmm.
Calories in, calories out.
And those are
Macronutrients.
pretty well going to be like the super healthy people that you're doing
Yes.
that stuff with?
It'll be someone who is coming into my office. I'll take you for an example.
Mm-hmm.
Someone who's coming to the office saying, hey, you know what? I don't want to get to a point where I have to see you for weight loss.
Mm-hmm.
I want to be preventative. Preventative illness is really important to me. My father just recently had a heart attack. You have these
Yep.
stories like, I just don't
Well,
want to get to
certainly
that
in
point.
our age, right?
Yeah.
And it happens a lot in the 30s and 40s.
Absolutely. I mean, we're
people are
seeing
like,
it way too early now.
Yeah.
I want to be preventative. Okay, so let's do your labs. Let's make sure, okay, everything looks good. You're right. Everything's fantastic. But let's put you on a plan to give you preventative illness down the road. So let's educate you and give you counseling on what exactly is going to be best for your physiology. What kind of metabolic structure do you have? And we can't just look at you and be like, yeah, he seems pretty lean. He seems pretty fit. But internally,
Yeah.
we don't know what's going on with that operation. So it could be completely different. It's just a matter of, that's why when I do sit down with the patient, like in order for us to work this plan the proper way, we need to see the operation to the blueprint.
Sure.
There's no way we can figure, I'm spitting in the wind. I'm shooting in the dark. I'm not, that's not the way I want to run my
Spaghetti against the
practice.
wall. Yeah.
Yeah, that's not the way I want to run it.
Yeah.
I want it to be something that's going to be solidified, that when I tell you this is what you need to do, it's like any other dietitian saying, okay, I'm going to give you the X, Y, and Z. What I decide to do is I'll give them the X, Y, and Z, but I'm going to discuss ABCs and elemental P's as well. We're not just going to stop at just the basics.
Right. Like
I want to build a
handout,
city
right?
on a foundation.
It's more than a handout,
Absolutely.
right? So, when you do a workup, do you do your workup? Do you have a pretty typical workup that you like to do, or is it completely independent based on who's coming in?
There is a baseline workup that I'll do in regards to labs. I'll obviously do the body composition test in my office, which you've seen. But it also depends on the patient and what they're complaining about in regards to their symptoms. Patient comes in, maybe they're our age, and they're just complaining like, man, I'm just super tired during the day. I got no drive, and that doesn't have to necessarily be sex drive, just drive in general. I'm having trouble getting out of bed. Well, I'm not going to clinically, label you and diagnose you as depressed.
Right.
But what I'm going to do is let's first check. Let's do the basic. Let's check your testosterone. Let's see where you're at, because now we know we're hitting hypogonadism, low testosterone earlier in stages of life. Let's check that. Let's just see where you're at, because that could clinically bring on depression. Vitamin D. No one ever checks their vitamin D. That is the first lab I'll ever check on somebody's vitamin D. You know very well with vitamin D deficiency. For me in my lane, increased weight gain, lack of weight loss. So weeks that you should have only gained a half a pound because you didn't do terrible, but you had a little extra, you gained 3.
Hence
and
the
4.
holidays.
Yeah.
Right.
And then the weeks that you should have lost weight, 3 to 4 pounds you should have lost because you were so restrictive, you're so dialed in, water intake was good, exercise was fantastic, you only lose a half a pound. It can be very discouraging to a patient. But vitamin D deficiency also causes increased anxiety disorder, increased depressive disorder, sleep deprivation, lack of multitasking skill sets.
Yeah.
So when you feel like you might have ADD, when you feel like you're sleeping bad because you're just thinking too much, and your anxiety is getting worse, your depressive disorder is getting worse, it could be all directly correlated to vitamin D deficiency, because the only way we get vitamin D exposure is abdominally. And respectively to you and your staff, it's like, are we really sunbathing for 35 minutes outside every day?
Because we're all working indoors.
Exactly.
Stuck
so
in
we're
front
all
of
vitamin D deficient.
Yeah. There's a lot of things in terms of conspiracy stuff. I think it's Jack Kruse or Jack Krause. We'll talk about that after the fact.
Yeah.
But it was pretty bizarre to hear why like the Southwest is actually so deficient in vitamin D, even though we're like in the desert and we're the most exposed to sun.
Right.
But yeah, we'll talk about that separately. That was kind of a fun one to hear. Okay, so I do want to just touch base on. By the way, all this is fantastic. Like I obviously your stuff. It's just coming off like you do this every day, which you do, right? And that's the thing. I know people want to work with someone who's confident in what they do. And so obviously there's been a dedication there, so I appreciate it. And the question that I have is now kind of going to shift gears a little towards like seed oils in terms of the good, bad. Could you let him out of there? What are they? Why are they so inflammatory? And like, which ones should we stick to?
That's a really good question, because it could range from a number of different scenarios. I usually am a big advocate of avocado oil. I like it because it provides a lot of good omega-3 fatty acids, which is very beneficial, reducing triglycerides, which are normally pretty high. Triglycerides, for those that are listening who might not be as familiar, it's the fats and carbs of our diet. So it's our contribution to our elevated cholesterol if it's elevated. So it helps reduce your cholesterol count or your triglycerides. It also can improve your LDL, your low-density lipoprotein, which is our cardiovascular risk factor. But I like avocado oil. The only problem with avocado oil when it comes to our society nowadays, with pretty much like when we were kids, we could get like a quarter pounder with cheese for like $1. Now it's like $6. People are looking for a cheaper option, but still the quantity. So avocado oil tends to be a little bit more expensive than your extra virgin olive oil. I don't have any issues with extra virgin olive oil. The problem is that we are starting to see more inflammatory response due to what's called reactivity. Not allergens, but reactivity. So we, at my practice, we use what's called Check My Body Health. Check My Body Health is a hair analysis test. It's been proven scientifically that it is going to be as accurate as an allergy panel, but it shows reactivity versus non-reactivity. So it doesn't say that you're allergic. It just shows inflammatory response to the certain item.
Which in general is going to be the most common thing that we experience. When people say allergy, it's technically, legally, medically, it's a IgE allergy, like anaphylaxis, right? So that we're not talking about that. We're talking about more of those sensitivities and the immune system reacting to whatever goes into your body and causing like a symptom, but you don't have an allergy, right? So and I'm just saying this from my position, because I have a lot of patients come in and they say, oh, I'm allergic to, and I'm like, well, is it a sensitivity or not? And they're like, oh, well, actually, I don't know. Most of the time, it's going to be because somebody ran some kind of sensitivity panel. And it's just easier to use the word allergy, so people just stay away from it. So you're not totally getting the entire picture, but I just wanted to say that because the immune system is so important in terms of creating inflammation that a simple like me and the popcorn, my body clearly did not like the popcorn, right? So I stay away from it.
Well, and that's, I try to explain to patients when we do these hair analysis tests, for instance, this is a reactive test and a non-reactive test. This is not saying that you're allergic to coconut oil.
Right.
This is just saying that you will more than likely have a higher response and reactivity to inflammation.
So maybe limit that. Like, it's not going to end your world, but like maybe limit that and like shift over to the avocado versus the coconut oil or something like that.
Let's go in every other for now. And keeping it simplistic for them. Because that's one thing that when it comes to dietary care, it can be very complex. And what I try to do is I try to simplify it as much as I possibly can, because there is so much out there that I have to fight a battle every single day just to give the patient the understanding that what you might have read, what you might have seen on TikTok and Instagram, I have nothing against these influencers, but what I do have against it is just the fact that provide a full picture for an individual, because we're not all created equally as far as our physiology goes. I might have insulin resistance and you don't. We're the same age. We might have grown
or we
up
eat the same
way.
diet, we work out, Right. The other thing, like even anything that he's giving, obviously, like substitute like an evaluation and do whatever he recommends. But like vitamin D, generally, most people are gonna do fine with vitamin D supplementation, right?
Absolutely, yeah.
And so I've had one person in my entire career have vitamin D toxicity. So it's gonna be very hard to get too much in.
Right.
Most commonly, what I see is people get put on the 50,000 from their doc once a week. It doesn't budge whatsoever. And so, and I don't even want to make a recommendation because it's like nobody knows what your levels are at, right?
True.
I know what I typically do and what I tend to move around when I did more of the functional medicine, but for what it's worth, I don't do the functional medicine anymore because I have people like you that do it every single day, all day long.
Yeah.
Other naturopaths who do they just do the hormone management. They just do, hey, this is not what I want to deal with. You go take care of this autoimmune. There's too much stuff for me. Let me focus on the neurology. And so then when we combine the freaking nutrition and the neurology and we get that dialed in, people lives are back,
Oh, absolutely.
And so, so I'm just really trying to feel out where you're going. I'm looking at taking a lot of my patients and getting them to see you maybe halfway, 3/4 of the way through. Let me get some of this piece under control, and then it's like then they have the motivation and the confidence to go down and tackle this part too.
Because this is a hard part. In my opinion, what we do in cardiology, neurology, neph, oncology, we're essentially trying to heal as much as we possibly can. Right. But when it comes to the dietary component, just like you take that holistic approach, it's a healing from inside out.
Yep.
And that takes a lot of mental commitment. And that's, one of the biggest reasons why I named my practice iCan Wellness. Because I've told you this before, but CAN is an acronym for commitment, accountability, and new. Commitment mentally to make sure that you're really involved in making a change in your lifestyle. Accountability. If you could be self-accountable, you'd never be sitting in my office in the first place.
Right.
And new. You have to begin a new lifestyle and understand this is the new way of your life. If you really want to sustain and you really want to maintain, you really want to achieve the optimal health and feel your best and stop accepting the fact that this is just how I feel. I feel like junk. I'm just tired in the morning. I'm sleeping like crap. My neck hurts. My back hurts. It's like this could all be just doing parts of the fact that you're doing something very simplistically easy to fix with your diet. And it's not taking anything away from any of the specialists that I deal with, especially you.
Well, and that's the thing. There's so many. If we all actually sat in the same room and worked on the same patient, the results would be like that.
Instantaneous.
It's just that's not how the system, right, which we're not in the system, but that's not how the system's designed. It's like you go to each individual and each person has to have your thing. We've had to kind of go all in on this because nobody else does this.
No.
And we have to do this extremely well. So then when we get say 2 or 3 of us together, we can make monumental changes in these people.
Oh, absolutely.
Right? In a very short amount of time compared to what they used to do.
And it's just now that's the investment of time and the investment of the commitment that they want to make to change their health.
Yeah, exactly.
Because I look at, not, I made the reference, not putting a Band-Aid over a gunshot wound, but suture you up and heal you up.
Yeah.
I want to make sure that you walk out of this office with the understanding of what you need to do for just this week.
Yeah.
It's baby steps because you had a habit for 30 plus years of your life.
Totally.
And you're telling you want me to change it in just 30 hours. It's going to take some time.
Yeah.
And I tell, my patients, you got to be patient. It's a process.
Yeah.
It's not a one size fits all. It's not scripted.
Right.
It's all individual to you and your needs, your lifestyle, and what you can and cannot do.
Yeah.
And I'll teach you those things, but it's not going to just be a 3-month program.
Yeah.
I wish it could. Trust me, I would love to have that revolving door, just having a whole bunch of patients in and cashing checks, breaking necks.
Right.
But at the end of the day, it's like, I know that's not the way to do it.
Yeah.
I know that the proper way of doing this is sitting down with the patient and educating them, giving them counseling, understanding that this is more between the ears than it is earlobes to toes.
Yeah.
With the physiology, I can figure out by just getting 3 tubes, a tiger top, a purple top, and a red top. I know that's how easy it is to find out the operation of what's going on. I know exactly what to do once I see those numbers. But I got to figure out how to get between your ears.
Right.
It's a psychological, I'm going to say this lightly for anyone who's listening. It's a psychological disorder, not a physiologic disorder. Physiologically, we have so much research and so much science behind what we know about how your physiology operates. We know what to do with that now. Now, granted, it is evolving. 16 years ago, we weren't even checking insulin levels.
Right.
Cortisol,
C-peptide.
C-peptides,
Yeah.
you name it. We weren't checking these things.
Now they're becoming commonplace, right?
It's now like a run-of-the-mill lab.
Yep.
So that's where I look at it as like, we need to find out, where did this start? Let's talk about where this started. Let's not talk about just calories in, calories out. You've done that.
Mm-hmm.
You've done that 5 different times with other programs. Why are you here in my office today? So that's where I want to really take more of a psychological approach and be more of a counselor to them. And what's your relationship with foods?
Yeah.
Why do you don't drink, you don't smoke, you don't do drugs, you food. There's only 4 void fillers that we have psychologically.
Yeah.
So the majority of the time, food's the most acceptable. And I don't like using this reference, but you see a 10-year-old outside of a grocery store drinking a bottle of vodka. You're not his dad, but you're going to go up to him and probably smack it out of his hand and find his parents.
Right.
But you see that kid, possibly 300 pounds, 10 years old, with a cheeseburger, you're not going to bat an eyelash.
Yeah.
And I'm not saying it's frowned upon, and that's the problem, is that we don't frown upon our habits with foods and how and our relationship with foods. And that's what I'm trying to better help my patients, is understand your relationship with foods and how you use it.
Yeah. And then how it affects you.
Yeah.
And then that's where the physiology comes in.
Correct.
So, man, this has been awesome. So what's the process to like get in touch with you, get started with you? What's needed in terms of like getting some help with you?
So it's as simple as just shoot me a text. I open up my personal line, for anyone to call me or text me. It's my personal line. It doesn't go to any assistance of mine or anything like that. It goes directly to my eyes. So you can simply just text me. I'm sure you'll probably put my information.
Yeah, you can say it, and then I'll just add it to it at the end.
So you guys can visit, my website, clientsecure.icanwellness.me, and my phone number is 623-715-5331. Again, that's a personal line to just directly me and me alone. So feel free to, say, hey, this is so-and-so. I'm just trying to get in touch with Dylan. It's going to be Dylan.
Cool.
You can also schedule online as well. I have a client portal online. You can schedule online. It's pretty much a half and half practice. I half see patients in office and half see patients virtually.
Cool.
Right now.
Do you have to establish them in person?
No.
Okay, so you can just go online.
Yeah.
Okay, awesome.
Yeah, I don't have to establish
I think
them in
COVID
person.
helped with that, right?
Yeah.
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 Awesome.
I can establish them however I need to. What's really awesome, we actually just got our 24th state. So we see patients in 3 different countries, including ours, and 24 different states across our country.
Fantastic.
So it is stemming from Florida to New York to Texas to Colorado, Utah, California, even patients in Arizona, that live in Arcadia.
Yeah.
Like, dude, you're
all the way
far.
over here by Desert Braided Spine.
You're kind of far. I was like driving the freeways. I was like, what is the 202 Red Mountain?
Yeah.
He's like, I don't know this freeway.
Exit 144. What the heck is this?
What is 44th Street? I don't understand that. But it's very
that's
easy
awesome.
to get in contact with
That's
us.
awesome.
It really is. And I'm always open, and I'm always accepting new patients. And I always make it work. It doesn't matter time of day unless, Russ calls me and says, I need you to do a podcast with me.
Yeah.
Then I'll say,
then we'll make the drive.
I got Russ.
No Zoom for that.
No,
that's
I
on site.
I can't do it with you today. I got Russ time.
So for the iCan, that's the letter iCan wellness.com or .me.
.me.
Okay. So do you have to do the client portal part first, or can you just go to the website?
You just go to the website.
Perfect. So we'll get that on there. We've got your cell phone.
Yep.
I've obviously got your cell phone. Just texted you. So I think that's it for there. Is there a typical like high-end, low-end type of introduction? Is it fairly easy to come see you as far as resources are concerned?
Oh, it's very easy to come see me.
Awesome.
It's very easy. Not that I have readily available appointments tomorrow morning.
Yeah.
But it's very easy to come in and see me and figure out a time that we could do it. In regards to prices, everyone's always asking like, what are prices looking like? Well, it all depends on your health history.
Mm-hmm.
If
the
you're
more complex, the more expensive. Okay.
That's the harsh reality of the world that we live in. It's like if I'm taking on more responsibility with not only just monitoring your blood pressure, doing your blood work, reviewing that every 8 weeks to make sure things are going normal, getting abnormalities back in the normal range. Yeah, you're going to be at a higher cost, but what I do is then I discount the price when your body gets into healthy range.
Yeah.
I take you off these medications, hypertensive disorder, blood pressure, whatever, cholesterol, diabetes.
Mm-hmm.
Once we start reducing some of these medications, all of a sudden it's like you're at a lower risk.
Yep.
I don't need to charge you as much.
And you can do the medication stuff because you have medical on staff, right?
Correct.
Okay, so just So people know, because I've always got to make the clearance that I'm not touching medications,
Yep.
but I work with people who do.
Yes.
Cool.
Yep. So we have our medical director. We have nurse practitioners in our office as well. IV therapy, medical massage therapists that do and specialize in lymphatic massage. So it's pretty much the most holistic, one-stop shop health and wellness clinic that you can get.
Love it.
You know, we're all on the same page. You know, we all sat down together. You know, I first originally went in there, and we just decided, you know what do we want out of this? Well, we want to be able to provide someone with true education, knowledge. You know, let's stop this runaround. Let's stop circling around this. Let's really educate people to what they need to do and give them the care, the quality of care that we expect to receive from our doctors.
Yeah.
And, you know, thankfully, you know, being as long as we have and experience that we have, we know what we would want out of it.
Mm-hmm.
You know, and we're not fabricating it. We're not sugarcoating it or beating around the bush. We're just being honest. Like,
Yeah.
this is what you got to do. And we lived it.
Yep.
You know, you lived your, you know, things with neurology as well. I've
Yeah.
lived my own journey.
For sure.
You know, when it comes to dietary care and weight loss. And so being in the chair is, I think, a huge win for us.
Yeah. It's crazy to think back, you know, like 20 plus years, all the nutrition stuff that was like, oh my God, I can't believe we thought that was the right thing to do.
Yeah.
But it's all we had at the time.
It's all
and it helped a ton of people.
It did.
But there's more optimization happening now, which is, people call it biohacking. I call it optimization, right? So
You know, I call it investigative research.
there you go.
Let's be real. Let's just understand, like, there's more to learn out there.
Yeah, for sure. There's
And,
always something.
I mean, you just Google best diet plan.
Yeah. Well, and it's interesting, you know, we just got a new autonomic testing device, which is basically an EKG, full tilt table assessment. It measures the hardness of the arteries. It gives you like functional age. It's like a freaking awesome assessment tool. And as I'm learning more about that, I'm like, okay, you need to go here. You need to go here. Hey, we need to really dive into diet because there's no reason you should be here, right? It's like the health of the system internally. We can get a look at that just from like EKG and all this other stuff, like aciobrachial index. But some of that, it makes it easier to say, hey, you might need Dylan, or hey, you might actually need psychology work, or you might need a cardiologist, right? And so the more we investigate, the more information we get, the better we can help that patient.
Absolutely. You know, it's a full circle. You know, you might have to see this other specialist.
Yeah.
You know,
or both at the same time, right?
Yeah.
We do that a lot.
Yeah.
And so that I love that you are online too. Like specifically, you don't have to ever actually meet someone or in person, right? But anyway, obviously he's a cool dude. He knows his stuff, knows his shit actually.
Yeah.
And you know, we could talk for hours and hours, and we have before.
Yes, we have.
We actually need to talk about when we're going to play some golf next.
Yeah, we do.
So we're going to
big
wrap
problem.
this one up. Everybody, again, Dylan at iCanWellness.me. Phone number one more time.
623-715-5331.
Awesome. Well, I appreciate it. I know everybody's going to get a lot out of this. We'll do this again sometime soon.
Yeah, absolutely.
And let's just have a great ending to 2024 here. Awesome. Thanks, bud.
Oh, man, it's already 20.
I know, it's getting there.
I don't
See you guys. We'll catch you at the next episode.
Thank you, guys.